Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Benita Talati. She's a patient advocate. Today's KevinMD article is Not All Patients Are on Disability. Benita, welcome to the show.
Thank you for having me.
So let's start by briefly sharing your story and journey.
Sure. So I call myself a professional patient because I was born premature and had so many health issues right out of the gate. We thought it was because of my premature birth, but it turns out years later in 2016, I was diagnosed with Ehlers-Danlos syndrome.
Hmm.
If your viewers or listeners don't know what it is, it's a connective tissue disorder caused by defective collagen, and it can impact your whole body, head to toe, in a very unpredictable manner.
All right. So tell us in general about your interactions with our healthcare system here in the United States.
Sure. So as I said, I have a connective tissue disorder. And so that means I've spent a lot of time at providers' offices over the years. And I've seen a change. I've seen a change where before you didn't have to wait as long, where before there wasn't this expectation of patients having to be patient and accept things as they are. And now there's this real shift. And I don't know if it's just solely pandemic related or other things as well. But now there's this real expectation that patients need to be more patient, if you will, and actually be okay and not complain about waiting 30 minutes for an appointment or an hour for an appointment. And so I've just seen a really drastic change.
Yeah. So what will be an example of that? Are you finding that when you go to your doctor's appointments, the wait time's a little bit longer and there's less of, or there's more of an expectation that it's just the way it is and you just have to accept it?
Absolutely, yes. So I spent the last decade seeing so many different providers, getting, so many different treatments, so on and so forth. And so before the pandemic, I definitely had that experience where we would be waiting forever and ever and ever, like an hour at least, 2 hours. So this isn't just limited to the pandemic and post-pandemic issues such as the worker shortage in the healthcare field. This has been ongoing for quite some time
Hmm.
now. And now there's definitely this expectation of, well, you know what, we're all burnt out. There's not enough of us that are working here, and you just got to accept it and be okay with it and stop complaining.
No, is this implicit? Has someone literally said to you that this is just the way it is?
Thankfully, no one's actually said it, but the attitude, the body language, so on and so forth, is what gives any patient that impression that this is just the way it is, suck it up and just be patient.
And how does that make you feel?
As a patient, I find myself feeling really frustrated over this, and what really got me thinking and writing this article is the fact that there's this real belief that patients can be patient, for lack of another word, because we have nothing better to do with our time. There doesn't seem to be this understanding that there are many patients out there who are employees as well. And we don't have the time to spend after getting to the office 15 minutes prior to the appointment, as is the standard protocol, right? That we all receive that email notification to just spend 30 minutes waiting for an appointment or an hour waiting for an appointment. There doesn't seem to be an understanding that we have lives too, and we are, responsible for earning our pay to pay those co-pays and the deductibles and all that goes into seeing providers. And so I just found myself feeling very frustrated over this.
All right. So you talk more about that specific point in your Kevin MD article. Not all patients are on disability. Now, for those who did get a chance to read your article, just talk more about that.
Sure. So I was inspired by this article because I moved back home about 8 months ago, and my twin sister happens to be an allied healthcare professional.
Hmm.
And just every day she would come home and just rant,
Mm.
go on tangents and rant about how patients don't work, patients are on disability, no one's working.
Mm.
So patients have the time to just sit around and wait for us. And I was just like, I wonder if she realizes what the problem is. Why is it that so many providers, including her and her colleagues, are getting this impression? And it dawned on me the hours that they work. Most providers work between 9 to 5 or 8 to 4, and that mirrors the typical workday for most other workers, right? And so what happens then is patients who are employees and not on disability can't necessarily make it to work, and to their appointments. They have to take their paid time off, PTO, and not everybody has generous PTO. And then when you're in a position like I was, waiting 2 hours for an appointment, I lost my copay and I lost my PTO time. And I had to make up the hours that I lost because I was a contract attorney at that time. And although it was a very flexible work, it also meant that, as an hourly employee,
Mhm.
I really had to work every hour that I possibly could.
Now, when you heard your sister come back and say those things and those impressions on patients, did you two have a conversation to maybe explore each other's perspectives?
I did actually try that. I did. And she didn't want to really have that conversation. I tried to explain that, did you notice that your hours are not exactly worker friendly? I had other not patient, provider friends who actually read the article and they said, oh, wow, I didn't even realize this. This is a really good point. I would never have thought about this. And so I'm glad that some people are getting the message while other people still need to be educated a little further.
So, in terms of possible paths forward, right? So, you mentioned things like extended hours, weekend appointments, maybe some virtual appointments so patients don't have to go into the office. What do you see as some potential paths forward to solve this issue?
Sure. So I actually see that this is a dual issue. It's not just on the provider side, it's also in the workforce, the employer side. I see it that we need to have flexibility on either both the provider side and the employer side, or at least on one side. Something has to give because if providers don't extend their hours, then a lot of employees who are working can't get the care that they need. And ironically, what I think a lot of providers may not be aware of, a lot of patients are on disability because they're going to the doctor so
Hmm.
much or physical therapy so much that they cannot reliably be reliable employees. And so that means they can't attend work regularly. And regular attendance is considered an essential function of the job. So that's the kind of irony, right? That so many patients are actually on disability, not because they want to, but because they actually can't work, because they can't do both. They can't work and, get the care that they need.
Hmm. And have you noticed any headway when it comes to some employers having that type of flexibility?
I think since COVID, there has been some sea change, right? There's definitely been a push for hybrid work schedules. There are, organizations such as mine that allow for remote work opportunities. So then, of course, telework or rather telehealth appointments can be, undertaken in the privacy of one's home versus, having to navigate all that in the office. Unfortunately, since the return to office push has really gotten underway in the past year, obviously we are seeing a push back against that. So while some organizations are moving in the direction of flexibility, unfortunately other organizations are moving away from that flexibility because there doesn't seem to be a greater understanding that we need that there are employees who have chronic illnesses, chronic pain, or have disabilities and are trying to manage both.
So tell us your ideal world if you were to design a clinic that would be patient friendly as you describe. What would that look like to you, just so we can understand? So in your ideal clinic, what kind of access, what would that look like to you?
That's a great question. And so I think that the ideal clinic, the ideal practice group, whatever you want to call it, would it be one that has extended hours? Would be one where they are available on weekends, in the mornings before 8 o'clock, in the evenings after 5 o'clock. This way, more people have that access.
Is there a role for virtual appointments to perhaps act as a bridge?
I think that's a really interesting question. To a degree, I think there is definitely a role. I will say, having had virtual appointments myself, there's definitely a difference between the quality of a virtual appointment and the quality of in person. And of course, there are some things such as gynecological exams, eye doctor exams, things of that nature that obviously cannot be done virtually.
And from your interactions with the healthcare system, what percentage or proportion would you say has that type of access that you're looking for?
The ones that take insurance don't really have that. Concierge medicine, any, practices that are out of network, they might have that access available in terms of availability. But of course, on the flip side, there's the issue of affordability, right? So if you don't take insurance and patients are responsible for paying everything out of pocket, if they don't have out of network benefits, then obviously it's going to cost more for the patients.
So, of your healthcare clinicians that accept insurance, most of them work, for instance, 8 to 5. That's the only time they offer office hours. Is that correct?
Correct.
Now, short of offering more hours or weekend hours, is there anything that we can do as healthcare clinicians to make things a little bit easier for patients?
Yes, I think one thing that comes to my mind is that maybe providers' offices could send text messages to let patients know of what the expected wait time is.
Mhm.
So if it looks like it's going to be a half hour to an hour wait, let the patient know ahead of time, and then they can make that decision of, maybe I'll reschedule. Can I come later? Can I, leave work later and then still be able to work that extra time so that they're not wasting their time? And then for hourly employees, such as myself, they're not losing that pay.
That seems like a pretty straightforward thing to implement. You go to restaurants and you have something like that, right? Are you saying that that's not the norm when you interact with the healthcare system?
So far, I have not seen that to be the norm. In some practices that I used to go to, I learned the hard way to call ahead and see whether or not the provider was so backed up. But that's after, having my first time experience. You learn your lesson the hard way, right? But I think that most organizations, they don't actually already have that restaurant style, order ahead notification.
How about from the patient standpoint? Because we, of course, have a lot of chronic patients who use the healthcare system a lot. Do you have any tips for them in terms of how to better navigate access or perhaps look for clinicians who may have hours outside of business hours? Tell us what kind of tips you can share to other patients who may be listening to this.
Sure. So one thing I would recommend is if you're part of a medical, support group, whether it's on Facebook, whether it's some other one locally or whatnot, I would ask around to see, first of all, if there are any other patients in your similar situation who may know about any providers who offer that kind of availability. That's the first step. The second thing I would say is to all patients, be polite, be respectful, advocate for yourself, and be firm, but be polite and ask, always ask, call ahead, maybe, you know, remind your providers and their staff that, look, I am working. Is there a way that we can ensure that the visit won't be so delayed? What can I do to ensure that my whole day is not going to be entirely screwed up? Things of that nature.
We're talking to Benita Talati. She's a patient advocate. Today's KevinMD article is Not All Patients Are on Disability. Benita will end with some of your take home messages that you want to leave with the Kevin MD audience.
Sure. For the providers, I would say, first of all, please understand that, again, as that my article states, not all patients are on disability. Please don't assume that your patients have all the time in the world to wait. Be thoughtful about your interactions with them. For the patients, I would say, again, be patient, but advocate for yourself in a respectful manner. If you know that you're working and you have limited PTO or whatnot, ask ahead of time. Ask and see what you can do in terms of getting your visit in in a manner that's good for you and beneficial for you. And also bring up these issues with your providers in their offices. See what can be done locally and push for things like notifications ahead of time instead of you having to do all the legwork for it yourself.
Benita, thank you so much for sharing your story, perspective, and insight. And thanks again for coming on the show.
Thank you. And you're welcome.